Hi, are people ready to go, or do you want to wait another 2 minutes until the end of the break? Raising your hand or saying? So when you folks are giving comments, I'm going to turn this on, so just to record what you're saying. So smile when you give me comments. Hi, thank you for coming. I'm Rose Hoban, and today I'm going to talk about, somebody mentioned one-man bands. It was you. So, or somebody here. I am a one-woman band. I used to be the health reporter at the little NPR affiliate here in the Triangle that we can see, and I recently left in order to start North Carolina Health News.org. I mean, in one way, one of the reasons I left is because my station wasn't using the web at all, and I wanted to do things like explainers, or put a map up on the web, or go to the web for more information, and couldn't do it, and really needed to spread my wings. So I'm going to take you through a very quick journey through the journalism landscape in North Carolina. Everyone needs, none of this is news. The fact that newspapers are going away. Health reporting was not the first beat that was cut, but it was definitely the second and third. This is the result of an informal survey I did. I called around to newspapers, called journalists I knew, stalked some people online. What I can gather is there were about 16 or 17 health reporters. The blue were full-time health reporters. The yellow were part-time health reporters about 10 years ago. This is the situation today. The red are full-time health reporters. That one right there, like this is Durham, that's me. The rest of them are this new one. That's the Wilmington Star News. They just got sold, so you know what that is. And the yellow ones are the people at the Triangle, Triad, and Charlotte Business Journals, all of whom cover 3 and 4 beats. And among them there is health. So they're really just doing journalism rather than journalism. So anyway, and as we all know, Research Triangle, 2 major medical research universities here, and there's no one covering any of this stuff. Not to say that there aren't newspapers in the state. There are plenty of newspapers in the state. These are just the daily newspapers in the state, not the community newspapers, which are published like 1 to 3 times a week. These are all 5 times a week or more. It's just that they're not doing a lot of health reporting. And disturbingly, where they're getting their health reporting is from hospitals, hospital PR departments. This is the health and fitness page at the Salisbury Post. It is completely produced by the Rowan Regional Medical Center. So this little slider over there has 4 or 5 or 6 stories on it, and those stories are like, Rowan Regional Nurse delivers the year's first baby, and we're doing the community 5K run, and this one is, everybody's so excited about the new ICU at our hospital. And that's not helpful, in case you didn't know that. And so, for example, I'm betting that this page has never had a story about hospital-acquired infection, or overdiagnosis, or overtreatment. It's just a hunch. Or a doctor who's malfeasant. So this is not an isolated phenomenon. I'm going to show you excerpts from emails and conversations I've had with publishers around the state. I'm going to give you a moment to read them. So this guy, was touted to me as being one of the most progressive thinkers about journalism in North Carolina today. And, so I said to him, yeah, it is bad journalism. He said this to me, I know it's bad journalism, but it's publishers. I said, yeah, that is bad journalism. How do I pitch my stories to a paper? And he goes, well, that's not what matters. I was like, whoa, I haven't cried for 15 minutes. So maybe I'm the answer. There's a certain amount of insanity, there's a certain amount of hubris that is involved in doing something like this. I tell people that what I have done is I did what every journalist should do, and that is I married someone who makes a real salary. And he's, so I received a Steve Tell Fellowship on April 24th, 2010, when I said I do. It's very exclusive, you have to sleep with the funder, sorry. But anyway, so he's basically said to me, why don't you give this a try for a year or so and see if we can get this up and running. So this is what we're doing. What has been so amazing about, actually, I'm going to go on to my next slide. I don't have money. I'll have a little bit of savings. I've raised about $4,000. I am not like any of these folks. ProPublica had $10 million to start. Voice of San Diego had Angel and Kaiser Health News, funded by the Kaiser Family Foundation. They had $7 million to start. So that's not me. I'm guessing that anybody who's doing this is more like me. These are some of the big players. I remember when ProPublica won its first Pulitzer Prize, and someone who is here at this conference, which I'll remain nameless, comes up to me and says, see, journalists can do good health reporting if they're, if they do it right or something. I was like, yeah, if they're getting paid for it and if they have time. So one of the real challenges is trying to do this, do it well, and do it on a shoestring. The question is the model. How the hell can we make it pay? And how the hell can we make a living on it? What has been most inspiring to me as I've tried to do this has been, I've had about every 2 weeks I get a phone call from a completely random health reporter. And I'll be on the phone and they'll say, when can I start writing for you? And I go, I don't have money. And then they'll say, that's okay. I think what you're doing is really great. And I'll say, you heard me, I don't have any money. And they'll say, that's okay, I can work for less, or I'm doing freelance stuff and I can piggyback and write something for you. So that's what's been incredibly inspiring, that people are interested in trying this. And since I'm doing the not-for-profit model, it means I have to fundraise to pay for everything. It's pretty exciting. But this is the reason why I'm here. I am looking for advice from you folks. This is the crux of my talk. If you were my readers, what would you like to see in a website like mine? What keeps you coming back when you look at things? What holds your interest? What topics that you're not seeing covered that you would like to see someone like me cover? Imagine I'm in your state, or hopefully you're from North Carolina. What are you not seeing? So, just quickly, I'm going to just show you a live link to my page. My web developer calls me yesterday and says, just tell them you're in beta. And I was like, okay. Because her kid's been sick for the past 10 days or so. So this is my website so far. What we'll have here is 3 or 4 stories, and a lot of them are state health policy. I've got something up about a new breed of mental health workers. The fact that North Carolina's Medicaid program saved $1 billion over the course of 40 years. These were all things that were very lightly reported in our standard media, if reported at all. Actually, what's going to happen right here is I'm going to have a blog where myself and I have a collaborator in Charlotte who's going to be working with me like 10 hours a week. We're going to be commenting on what's happening in the national scene, but making it North Carolina focused. I've got some faculty from the family medicine program at UNC who are really quite sharp. We're going to do some consumer health work for me. But what is it that people are looking for? What are you interested in having on a website like this? And I'm just going to turn this on. And please, if you had your drugs, what would you have someone like me doing?
Dear Global Public Health, if I were looking at a site like this, I would want to know about outbreaks in my area, and if my child's flu, my symptoms might be flu, because a whole bunch of kids in my area have flu or something like that.
Okay, that's great. Thank you. Mm-hmm. Any other ideas?
I would think stuff about rural health issues, because I think especially in North Carolina, we might hear a lot about what's going on in Charlotte, Raleigh, but I mean, there's so many of our 100 counties in this state that there's no one there, like you said, to report on it, but obviously to say what's even going on in some of these hospitals and everything else, that's kind of a hard request, because then you have to have more bodies in those counties. So.
Right. Or you need to have a good phone list in those counties. Yeah, that's a good point. Any other thoughts? What about things like, I'm thinking about, I just talked to someone today who's doing a neurobiology podcast, and I said, can I steal your theory? And she said, sure. How much time are people willing to spend, this is kind of a loaded question, how much time are people willing to spend when they're doing their news perusal in the morning? I mean, I don't know about you, but I read a bunch of news websites in the morning, and then a lot of the other stuff I'm reading is fun, for interest. When you're perusing a news website, how much time are you willing to spend on things like, say, photo galleries or video? What are you interested in seeing?
Videos are good. They help you just kind of sum up the story very quickly. You don't have to spend, 15 minutes reading a story or things. Is that great? But you can just kind of look at a video recorded in 2 minutes, just kind of sums up whatever issues that you track over that day.
How long video are you really interested in seeing?
In terms of the length of the video, like anything between 3 and 6 minutes would be probably tops.
Great, okay.
And I think podcasts are great because that expands the time. You're not sitting there perusing. You can be in your car listening to it on the way to work or while you're running or any other place. It expands your news viewing time if you have a podcast.
So a podcast that sort of is a digest of
Audio only.
audio, and they digest of yesterday's news, digest of today's news.
Yeah.
I have lots of audio experience, so I can do that. I can actually read it in my authoritative voice. So, any other thoughts?
Something that would be
No, let you go because you just.
something that I find useful, and I don't see done a lot, is we're talking about digest, but something in the evening that has us looking at what news are we like we're expecting from the day from the next day, and just kind of look out, the city is doing that, or just kind of keep an eye on what's coming out. Like this is something that very few publications do, and I find it extremely useful.
Almost like a day book, like the
Kind of like an agenda, this is what we're going to do.
I just had two general concepts, that of One Health, going out away, just from human medicine and expanding.
veterinary health.
Exactly, the One Health concept. And also, and this sort of addresses some of the rural disparities or other health disparities, but that is population health. Looking at access to recreation areas and other things, so expanding away from just the view of health as medicine, nutrition, recreation, the other facets of health.
So if I were to put up a map and say, click on here and add where there's a good playground for your kids to play, would you be clicking on that?
Not necessarily, but you could have a visualization that would show areas where you have to drive 13 miles to buy an apple or any other fresh fruit, or schools that have never served fresh fruit in their schools, or things like that. It's not necessarily, I'm not looking for a playground in my neighborhood, but it might be shocking to people to see that there are many people in this state that don't have facilities.
The playground in my area map is a neat idea in itself too, and in that case it's more, I think there are things like that that are resources that have a sort of long-term reuse value that people would find useful, and then other things that are sort of like stories that have a time moment that come and go. But it is interesting to think about because those resources are things that will keep people coming back potentially, or communicating on more long-term.
So I'm thinking like the playground in my area kind of thing. It's interactive, so you get to start to get that dialogue with your readers, and and then they feel like they can participate. So then the next time I do it, it's sort of like grocery stores in your area. Click on where there's a grocery store.
Well, in those cases, it may be worth thinking about how to surface them as more long-term things, because you can run them in the feed of news, but you also kind of want to have maybe there's 4 or 5 things like that over
The
time
icons that will
that you're
take
calling out that sort of people sort of have their own recognition as ongoing things.
Thank you. Any other thoughts?
What about a lot of different health indicator maps? So it's like easy, accessible for people to know.
Data's out there.
Yeah.
Mm-hmm. Yeah, that's great. Thank you. It's great. This is what I wanted to use this for, so I appreciate you taking a little bit of time. And I'm just going to leave. This is one of my favorite political cartoons that I've come across in the past year. And this is why I'm doing what I'm doing. Well, not this. So I thank you, Thomas Jefferson. So.